the way to describe how radiation is given is it's most analogous to getting an X-ray. So it's actually, there's a variety of different ways in which radiation therapy is delivered. Most commonly, it's delivered via external beam radiation therapy, which is where the radiation is generated outside of the person and then delivered into the body. And that's the most common form of radiation therapy that I use. And those, what are called linear accelerators, which are the machines that are used to create highly conformal beams of radiation therapy, are on an arm, so the person isn't necessarily inside a tube or inside a donut, which would be typically what a CT scan uses. They're oftentimes just lying on a table with this machine on an arm that's moving around them. That's the most common type. There are certain types of radiation therapy that are delivered with more of like a CT scanner type apparatus, and then there's other types of radiation altogether. So, for example, implantable forms of radiation therapy where radiation is within seeds, typically of some form of metal, and then placed in the body to treat an area of cancer. Prostate brachytherapy is the most common example of that. In other words, it's either generated kind of external to the body and delivered with very sophisticated machines, or in an operating room setting, placed within the body, typically on some form of metal, like prostate brachytherapy seeds, which are these seeds of metal that have radiation therapy within them that are placed within the tumor itself.